Hi, I'm Dr. Eric Mazer. Our viewer question this week is, what is carotid artery disease? We have an expert on the set, vascular surgeon, Dr. Alan Dietzek, and he will tell us what is carotid artery disease. Alan?
Thank you, Eric. So carotid artery disease is a buildup of plaque, which may consist of calcium and lipids, which actually narrows the artery, specifically the artery that supplies blood to the brain.
Which is not good.
Which is not good, because if that plaque should break open, what can happen is little particles can go to the brain and cut off blood supply, which results in a stroke, sometimes a mini stroke, which resolves, but a permanent stroke.
And what are we looking at here? We're actually looking at a carotid artery, which is red, and the plaque, which is yellow.
Yes, and you can see that that's right in the neck there, right below the jawline, and that's the area which becomes built up with the disease and the area which we treat when necessary.
And then I know that area also causes blood to clot, platelets to stick together, because it's not normal, smooth, slippery endothelium of the vessel.
It's turbulent flow, and when it gets more narrowed, it becomes even more difficult for the blood to get through that area. So it might be helpful to be on an agent that thins the blood, but if it becomes stagnant there, little clots can form.
And in 30 seconds, maybe the treatments, once you've found you've had this, and particularly if you're symptomatic with this?
Well, if you're symptomatic with this, you would want to be evaluated by a vascular surgeon for an intervention, usually carotid surgery.
Yeah. And we also have aspirin and Plavix and other drugs that can be useful for some people at other stages.
If there are no symptoms, those may be a useful adjunct. Once you have developed the symptoms and you've identified that there's disease, it has to be removed.
Okay. So that puts you in business. And so if you have questions at home and comments, please mail them to us at healthtalk@wchn.org. We'd love to hear from you, and thanks for watching.